1.
Good afternoon, and thank you for tuning in to this week's episode of Hello Health, where we talk to some of your favorite doctors about health and wellness. My name is Grant Dodge, and I'm with Health Benefits Associates, and I'll be your host for today. Health Benefits has offices here in Reno, Sparks, and Carson City to help you with your health insurance and Medicare. So if you have questions about those, please make sure to reach out to our office. Now, this YouTube channel is not just for our Hello Health series, but it is also for our upcoming Mastering Medicare series, where you can talk to a broker and Medicare expert just like myself to get you prepared for the upcoming Medicare annual enrollment period. Now, that starts on September 15th. So make sure to put that down in your calendar. But a great way to make sure that you are prepared for those series is to subscribe to our channel using that subscribe button below. When you click that, that will make a bell appear where you can click that bell and make sure that you get notified for when we go live here for both our Hello Health series and our Mastering Medicare series, as well as other general topics. We go an update on all sorts of health insurance related information and important laws and regulations. So make sure to subscribe to our channel so you do not miss those important episodes. Now, before we get into today's presentation, I just want to make sure everybody's aware. We are going to be answering your questions, so make sure to ask those questions in the comment section on this page, and we will be answering those at the end of today's presentation with our guest. So make sure to put those questions in there so that we can get those answered for you. Now, on to today's presentation. We are here with Dr. Denis Patterson with Nevada Advanced Pain Specialists regarding aging and pain. So great topic today, and certainly we are really excited to have Dr. Patterson on the show today. Really looking forward to it. Just a little bit about Dr. Patterson. He is certainly more than qualified to talk about this today because he is quite a special guest for us, and I'm going to tell you why. He is the founder and owner of Nevada Advanced Pain Specialists. Dr. Patterson is a board-certified pain medicine and physical medicine and rehabilitation physician. He is also on the board of directors for the Pacific Spine and Pain Society, and he was recently nominated as one of the top 25 physicians here in Northern Nevada. Finally, Dr. Patterson was recently nominated and awarded the Health Care Hero Innovator of the Year for 2021 by the Nevada Business Magazine. This is a huge award and only given to people that have taken the extra mile to reach out and help our community for a lot of our healthcare challenges. So let's see if we can get Dr. Patterson in here. Dr. Patterson, can you hear me?
Yeah, I can hear you. How are you doing, Grant?
Your important time today to join us here on Hello Health. Now, keep in mind, before we jump into today's presentation, we are going to hand it over to you here shortly. You're going to go through your entire presentation, and then we will have questions that we will have our audience be asking you. So make sure, if you are asking questions today, make sure to ask those questions, ask them throughout Dr. Patterson's entire presentation, and then we'll get to them when he's finished. But we're going to hand it off to him here. So Dr. Patterson, take it away.
Hey, thanks, Grant. I appreciate you guys having me on today. I've been here in the Reno Tahoe community since about 2007, helping patients with chronic pain. So it's a topic near and dear to my heart. I'm very passionate about doing it. And, I'm always looking for the newest, latest, greatest thing that I can help my patients because I figure if I'm at the cutting edge, then I should be ahead of the curve and I should be able to help as many people as I possibly can. Before I start talking about pain and aging, I just want to kind of give some statistics about chronic pain. So if you look at people that are polled in the United States and ask them if they have a moderate to severe chronic pain issue, what we find is that about 100 million Americans say that. That's about 28% of our population. When you take that number and you add it up, that is more people suffer from chronic pain than they do from diabetes, cancer, or cardiac disease combined. And when you look at the cost to the system, it's about $650 billion annually spent on helping patients with chronic pain. And on top of that, we see that over 100 million lost work days are lost due to people not being able to make it to work or because they're seeing their doctor or they're just incapacitated and unable to do their activities of daily living. Biggest pain complaints that we typically hear are number one is lower back pain. That's the number one cause of disability worldwide. Number two is migraine. That is number two on the list. So those are the most common things we normally see and treat. And so let's talk about pain aging. I think the Medicare population is probably the number one subset of patients that I see in my clinic, and it can be a variety of issues. But let's start out today's conversation about this, just discussing age. I want to quote Mark Twain: "Age is an issue of mind over matter. If you don't mind, it really doesn't matter." But let's look at the elderly population. I mean, this is a growing part of our society. So if you look at this, it's about 12% of our population now, but by 2030, it's predicted that it'll be about 20% of our population, or one-fifth of our population will be over the age of 65. That is 72 million people. More interesting, if you look at this population and you ask them about who suffers from chronic pain, what we see is that 75% of patients over the age of 65 report a common pain issue. And if you look at it, women more than men will describe having some type of pain issue. And overall, 66% of our healthcare dollars are spent on two-thirds of the population that experience some chronic pain condition or have multiple medical comorbidities, multiple health problems, I guess I should say. But let's start with the hallmarks of the elderly in pain. I think there's four categories that I like to highlight. Number one is activity and exercise. Number two is going to be sleep disturbances. Number three is going to be mood. And number four, we're going to talk about cognitive issues and how pain affects all of these. So activity, first thing is that I think a lot of patients as we get older, we do not feel as agile or have the ability to be as active as we used to be. And the number one reason is usually we have a fear of falling. And I think we've all heard the story that you fall and you can break a hip, and I'm sure we've known somebody. And if you look at the statistics, is that if you do fall and you do break a hip, about 1 out of 5 patients will die as a consequence of that. So I think as we lose our ability or our ability to feel safe with walking and have less agility, that fear of falling increases. This leads to negative consequences, specifically decreased activity levels. So we don't want to be up, we don't want to be moving around. The less active we are then leads to weight gain. The more weight gain we have, the more stress we put on our joints, especially our weight-bearing joints. Now you're talking about your lower back, your hips, your knees. Well, if we have more, that leads to even more increased, less agility, which then leads to more increase with fear of falling, and it's just a negative cycle, and it has to be broken. So I think the first thing is we got to remain active. If you don't use it, you lose it. That's always what I say. So exercise is critical. And so If we're able to lose weight with exercise, we take the stress off the lower back, the hips, the knees, and we can feel a whole lot better. But how do we do that when we're afraid of falling? And I think the number one thing that we can do is encourage our older patients to get into some type of water exercise program. Why is water good? Well, water has buoyancy. When you have buoyancy, it kind of takes the pressure off your joints. So when you're in the water, you feel safer, you feel lighter, you're able to move more, and you can actually kind of increase how much resistance you have by how deep you go in the water. So if you stay in the shallow end, you'll have less resistance, but if you go to the deep end, you'll have greater resistance. Unfortunately, we don't live in a pool. So what I recommend is that you get started in an exercise program, you increase the resistance by going into the deeper and deeper end level. And once you get more confident, then you should transition that exercise program to a land-based program. You can even work with a physical therapist and they can work on, out of water, balance exercises and strengthening to make you more safe and able to do what you need to do. So that's the first thing. We got to move. We got to keep going. We need to exercise. We need to keep the weight off. The second thing is if you look at studies about sleep, patients who don't sleep end up developing chronic pain. One of the most famous studies I remember was a study that they did where they took college students and they hooked them up to sleep machines. And what they were doing is they're looking at the stages of sleep, and they wanted to prevent them from getting into REM. REM is the most restorative stage of sleep, and it usually occurs, at the end of the night after we've been asleep for several hours. In this study, what they ended up doing is that when the students would get into REM sleep, they would go in the room and wake them up. And what they found is that after about several nights to a week of doing this, the college students started complaining of diffuse pain all over their body. Well, at that point, they let them get a good night's sleep, and what they found is that all their pain complaints resolved. So I think if we have some pain issue, it could be related to some type of sleep disturbance. So you may want to pay attention to your sleep cycle and how you're doing. The other negative consequences of not being able to sleep at night, it leads to daytime fatigue, which then leads to more inactivity and an excessive amount of time in bed, which then again, we're kind of back to our problem that we were talking about earlier, weight gain, fear of falling, and not being able to stay as active as we need to do. The other issue that you're looking at here that could just be a natural consequence of aging. Our awake sleep cycles depend on two chemicals in our body. One is cortisol. Cortisol is what keeps you awake during the day, so usually it spikes early in the morning. And melatonin, that usually increases or spikes about an hour or two before you go to bed. What we've seen in the aging population is that they don't make as much melatonin as they used to, and so we see lower levels. So you can supplement with over-the-counter melatonin. I've talked to a sleep specialist about this, and they recommend starting out with 1 milligram about an hour or two before you go to bed. If that seems to help, continue it. If it doesn't, you can increase up to 3 milligrams 1 to 2 hours before bedtime. That exogenous or pill form of melatonin just helps restore that spike that you used to get before you went to bed that your body is no longer able to produce. Now let's talk about mood. I tell patients with chronic pain all the time that I expect them to have some type of underlying depression or anxiety as a result of pain. I mean, let's admit it, pain impacts your life. It affects your quality of living. And if you look at, depression in the older population, what we see is that 28% of them will develop severe depression if they have some type of persistent pain. But what we see also is that 75% of older adults who get in a multidisciplinary pain clinic show lower levels or no depression at all. And so what does multidisciplinary mean? Multidisciplinary means that you have a doctor who treats you from multiple facets. And I call it the biopsychosocial model. So your physician should not only treat you from a medical model, but should also treat you from a physical model, i.e. physical therapy. And then the bio part is more your cognitive or how brain is affecting your mood. And so having a behavioral health specialist on hand to help you. So at our clinic, we really try to focus on getting patients involved in the biopsychosocial model. So we'll have them see our behavioral health specialists if needed. We definitely get them moving with seeing our physical therapist. And then they'll see myself or some of my advanced practitioners to kind of help out with the medical aspects of their pain. Now, cognitive issues, as we get older, we may develop some type of dementia. And what we find is that half of patients with dementia have chronic pain. And a lot of research has shown that these patients may experience chronic pain differently, but their perception or the severity of their pain is real. So we shouldn't ignore it. In patients who are demented who have pain, it can result in increased agitation, aggression, and confusion, something that should need to be avoided. So we need to be aggressive with treating their pain. But let's talk about this population and how they can be difficult to treat. And I think it's because this population grew up, 1945 or later. That's kind of part of the World War and Great Depression generation. So they lived through hard times. It wasn't socially acceptable to talk about it or do it. You just lived with it. It was the normal. You just moved forward and did what you could. And so a lot of these patients don't feel comfortable discussing their pain. The other thing that they have the social support. They don't want to become a burden on their loved ones. So they don't want to talk about their pain out of fear that they will put others out around them that they love. So you may find that they may hide their symptoms. So the first thing that you need to do as a healthcare provider is you need to earn their trust. By earning their trust, it will reduce their fear. It may eliminate that stoicism they have on preventing them from talking to you about the actual pain that they're suffering from. So that is the key, is getting to these patients to trust you so you can help them out. And then I think once you get their trust and you understand their pain complaints, is get them in the appropriate multidisciplinary treatment that's appropriate for that patient. So not one size fits all. Some patients may just need physical therapy. Some patients may just need behavioral health to help them. Others may need a combination of that plus some medical intervention. So you got to be aware as a physician on what is the best way to treat each individual patient and not try to treat them all the same. And that's basically it. That's what I want to end today's conversation with. I know, Grant, there's probably been some people writing some questions, want to learn more. I'd be happy to answer any questions you guys got today. That's what I'm here for. Always want to be a good steward and help my community and do the best I can.
Yeah, well, thank you, Dr. Patterson. That's a great presentation. I think we got a lot of useful information in there. Before we jump into those questions, make sure that if you enjoyed our presentation today with Dr. Patterson, don't forget to like that video down at the bottom. Make sure that you let us know so we can bring more content like this to you here coming forward. But let's get into these questions with Dr. Patterson. I think we have some good information here that we want to get from him. So first question here is from Dorothy. Should I limit my activity as much as possible if I'm in chronic pain, or should I exercise more?
No, you should definitely exercise more. And even though I say you should exercise more, that doesn't mean go gangbusters, the first day out. You need to gradually increase your tolerance for exercise. So say like right now, the most you can walk is like a half a block. Well, maybe tomorrow you walk 3/4 of a block. And you do that for a week or two. Once you don't feel as tired or put back after doing that, then maybe increase that to a block. So staying active, gradually increasing, you'll be able to do much more over time with less pain. And that's the key. You got to stay active.
So progression, really important.
Yep, progression.
Okay. All right,
Don't
let's see
overdo
here.
it. I mean, if I tell you that exercise is good and they go run a marathon tomorrow, that's probably going to hurt a lot because they haven't done that ever,
Yeah. Great. All right, well, let's get into the next one here. This question is from Edward. Sounds like he doesn't work out like he quite used to. Is pain something that is just going to be inevitable for him as he gets older, or is there ways that he can delay pain or stop pain altogether or prevent it altogether going forward?
Well, first things first. Let's talk about is pain inevitable as we get older? Well, the statistics will show that every decade of your life, you have a 10% chance of developing a chronic pain issue. So that being said, it is common that you will develop a chronic pain issue the older you get. Does it mean he will? No, it doesn't necessarily mean he will. Hopefully, he'll be one of those lucky few that doesn't get a chronic pain issue as he gets older. The second part of that question is talking about what he can do to prevent getting pain. And I think that's just, living a healthy lifestyle, eat well, so a good nutrition can be very beneficial to what you're doing. And then two, just remaining active. I think those two things are the key to trying to avoid developing a chronic health issue, let alone a chronic pain issue.
Okay, got it. Okay, so it sounds like there's at least a few different parts that you need to combine to help preventing and maintaining those chronic pain.
Correct.
Okay, great. Let's take a look here. Does pain always progress or worsen over time, or is there a way to just kind of keep it at an even keel?
I don't think there's any rhyme or reason, and so I don't think anybody can predict if their pain's going to get better or worse. I think the key is just getting, if you do develop a pain issue, is getting evaluated and trying to figure out what is best for your situation to either keep the pain at bay or hopefully make it go away. But just because you develop pain, it does not mean it will increase. And just because you've seen a doctor doesn't mean it's going to go away either. So I don't think anyone can really predict if it's going to increase or decrease, but I think it's finding the right program for you that either helps that pain stay the same or decrease, but not increase.
So there are many different ways to manage and prevent pain, and it's just kind of dependent on the individual that's in your office.
Correct. And when I evaluate patients and I talk about the pain, I talk about specifically 5 things that I can do for them. So off the top of my head, I always try to do it from the least invasive to the most invasive. So number 1 would be modalities. Modalities would be like, is ice going to help this condition? Could heat help this condition? Would add TENS unit. TENS unit is kind of an electrical stimulation unit that can, subtract the pain that goes to the brain and makes it feel like their patient's getting a more massage over the area. So I always think about those things as the first line therapies. Do those cure patients? Absolutely not. Do they make them feel good in the meantime while they're using them? Yeah. Second thing is medications. And medications can be anything from topical to over-the-counter to prescription meds. Prescription meds can be anything from a muscle relaxant to an antidepressant to a neuropathic pain medication to opioids if needed. The one thing about modalities and medications is that they really don't cure anything. They're basically just masking the pain and covering it up and making it more functional. My goal is to utilize those and to get you into a more active treatment. Active treatments, the first thing I look at that's least invasive is therapies. And that could be behavioral health, physical therapy, acupuncture, it could be chiropractic care. Maybe one of those things is going to make your pain resolve by changing the biomechanics of your body or changing your thought process about your pain. The next thing is then interventions. And interventions, I think about, is there some type of injection I could do? Is it an epidural, a radiofrequency ablation, a sympathetic block? So there's many injection options that, as long as you're doing the injection for the right diagnosis, then that can really help patients out. And then the last thing is there something surgical that needs to be addressed? And if you do that surgery, would it resolve the patient's pain completely? And so I'm always looking at, the patient's history, physical examination, and does it line up with some lesion seen on some type of imaging that if we remove that, would the patient be cured of their problem? And so those are the things that are always in the back of my head when I'm recommending treatment for patients with chronic pain.
Okay, got it. Great answer. Great information we're getting here. Now, is chronic pain just for seniors, or can a young guy like myself, do you see young guys like myself in your office with similar problems?
Oh yeah, I see patients in their early 20s, 30s. Usually at that age, it's not from natural degeneration. It's usually from some type of condition they're born with. So they may have an autoimmune disease like rheumatoid arthritis. They may have diabetes that they've developed painful diabetic neuropathy, or young people who've been involved in some type of traumatic accident, like motor vehicle accident, a fall. It could be multiple things. And so it doesn't necessarily have to be elderly patients. Young patients can have chronic pain as well too.
Okay. Okay. What's the best way to make an appointment with your office?
Oh, God. A couple different ways. One, our website is nvadvancedpain.com, and there is a make an appointment button that you can link up to us and get in. The other way is you can call our office. It's 775-284-8650. That's 775-284-8650. And just ask for the new patient scheduler. Her name is Dixie. I think her extension is 114.
Great, great. Let's see here. Any other sort of questions we have? I just want to make sure that we get all of those in here. It looks like that is going to be it for our questions and answers today, Dr. Patterson. So once again, really, really want to thank you for taking your time today to come on the show. We really appreciate it. Hopefully we can have you back again in the future, but thank you so much for sharing your expertise and knowledge with us today. This was a great presentation.
Hey, thanks, Grant. I'd be happy to come back anytime you guys would like me to talk on any topic. So I appreciate you giving me the time and the platform today.
All right, thanks, Dr. Patterson.
Thank you.
All right, well, what a great presentation that we had today. A lot of great information. Really looking forward here to our next presentation, which is actually tomorrow. Not our normal scheduled Wednesday time, but tomorrow, July 29th at 10:30 a.m. We will be with Dr. Phillips and Alex Sampson out of our office. So make sure that you tune in for tomorrow. Don't miss that one. Now, on the right, or actually for the upcoming or other Hello Health schedules here and events, you can follow the link down below in the description of the video where you can go to our website and see the full list of the Hello Health events as well as the upcoming Mastering Medicare events, which start on that 15th of September. So make sure that you go there, and don't forget to subscribe to our channel. It's the easiest way to not miss these episodes. Hit that subscribe button and hit that bell button so that you're notified for when we go live. But that is going to do it for today. Really appreciate all of our viewers coming on and going through, asking all those questions and participating in today's presentation. Hope to see you tomorrow. My name is Grant Dodge with Health Benefits. Thanks for watching.